Hi, my name is Parth Borker, and welcome to the third episode of the BCA Health Policy Conference. In previous episodes, we've discussed specific medical topics such as medical marijuana and the opioid crisis. While these are very important, there are many more facets to health policy, and the topic we will be discussing today, Healthcare Advocacy 101, takes a different, more patient-focused approach to healthcare policy. Mr. Ganesh Balaji, a medical economics analyst at Aetna, has graciously agreed to speak on the subject. Joining me is fellow student Raiyaan Shaik, and he will be asking the questions today.
Hi, my name is Raiyaan Shaik, and I would like to thank Mr. Balaji again for agreeing to this podcast.
Alrighty, so as Parth and you as well, Ryan said, my name is Ganesh Balaji. I've so far accumulated quite a bit of experience in the healthcare industry, but more so recently, been focusing on the patient side as well as the insurance side and how policy affects all kinds of people on different socioeconomic different socioeconomic backgrounds and walks of life. But as both Parth and Ryan described, my experience initially was more focused on medicine, and that was my goal initially. But now I do more analysis on medical cost trends and how that's been changing in recent years, especially with the advent of the Affordable Care Act in 2010. So all in all, I feel like healthcare advocacy is more important, more so now than ever before, especially with all the disparities we see in different marginalized communities. But we can get into that as discussion continues.
So, as you said, healthcare advocacy is at its most urgent in this time period. So, we could start off by asking, what is healthcare advocacy and why is it so important?
Well, in my mind, I think healthcare advocacy is providing direct care to individuals without really sort of forcing them to get their care from primary care physicians or to other doctors or specialists. I think advocacy entails providing a community approach to healthcare and treatment for those that need it. So I think you both mentioned that you spoke about the opioid crisis, and that's one thing that touches on healthcare advocacy. But broader picture, I think healthcare advocacy is super important because, as we've seen in recent years, the current healthcare system is just not delivering for everyone. I think there's too much focus on maximizing profit, and my company, I'll blame them first and foremost. But I think it's part of the larger problem with healthcare in this country in general. So yeah, I think healthcare advocacy is just providing a multitude of different treatment options, whether it's mental health or or drug addiction or just not, with how the healthcare system is created right now. It's more so with the volume and seeing how many patients doctors can see without really taking into account the preventative measures. So I think healthcare advocacy um, touches on that idea.
Okay, so based on the functions of healthcare advocacy you gave us, I think we touched upon what healthcare advocates do, but is there anything else that you would want to expand on?
Well, I think there's been a wide need for change, and I think the Affordable Care Act in 2010 tried to tackle a lot of those issues, but left a lot of issues in its wake as well. One thing that the ACA did do right was that it incentivized people um, in seeing their primary care physicians and sort of um, doing different things to prevent larger issues by not taking care of their health. Um, and in that same vein, it sort of incentivized a new sort of branch of healthcare, which is healthcare advocacy, because it made that even more important in adding to the picture of the overall healthcare plan for an individual. Unfortunately, you know, insurance companies and different companies within the healthcare space didn't really see that as a good business model for them. So in recent years, we've seen that although there's been an effort to include healthcare advocacy and more patient-centered approach to taking care of individuals, not just seeing the primary care physicians or specialists. There's a bit of a tug of war going on, but I think uh, healthcare advocacy is more important now than ever before, just because we're seeing that more and more people are just not getting healthcare.
Okay, yeah. Um, so, how can someone in society find a healthcare advocate?
That's a good question, and I might not necessarily know that off the top of my head, but there are a lot of resources that are available, a lot of nonprofits. In fact, within my local town, there are different nonprofits that are available that sort of offer volunteer options or volunteer opportunities to young kids or young adults who feel like they want to make a difference and really tackle this healthcare issue that we face today. Um, I know within my own company, there's a lot of colleague resource groups that I'm a part of, where I try to serve the underserved communities um, by going to soup kitchens and just as part of the junior achievement group within Connecticut. Um, I go into these communities that don't have the education and healthcare they need, at least with the children. Um, but all in all, I think it's tough for me to point to specific examples that people can do to um, to be healthcare advocates. But I think um, I think there are ways to, if you're truly passionate about healthcare advocacy, there are different options that you can look into on the internet.
Okay. Um, so, in what situations should an individual consider approaching a healthcare advocate, and what steps would they take to do so?
That's a good question. So I think there's a lot of stigma um, with with uh, with health, and it's a very private matter when someone is dealing with healthcare issues or health issues, and they don't necessarily want to be honest with their loved ones, and let alone the primary care physicians who they don't. For a lot of people, they don't really know their PCPs or their specialists on a personal level, so they're sort of disengaged or they're dissuaded from really approaching them or having those tough conversations and being honest with their health. So I think that's where healthcare advocates can come in and um, really help those individuals who don't feel like they have a voice or an option to speak to someone and who can point them in the right direction for their long-term health. Um, I think, you asked about specific people who might need healthcare advocates or could see some value in speaking to healthcare advocates. The first kind of people that come to mind are young adults who are struggling with mental illness, who, it's still a huge stigma in society today. Fortunately, in my opinion, that's starting to change. I think my generation, especially the generations coming after me, I think they see mental health as a huge issue and something that's as important to deal with as a physical ailment or illness like diabetes, cancer, or heart disease. I think mental illness is right there on the same sort of playing field in importance. But I think those kind of individuals who still feel like they don't want to be judged based on those conditions that they might be experiencing, mental health illnesses, I think they could see some real benefits from speaking to a healthcare advocate who is a well versed in that specific um, medical specialty or field, and B who can then who's well connected with the right professionals, medical professionals, who can then um, properly take care of those individuals who need the help. Uh, but going back to healthcare advocacy overall, I think again it's not necessarily on an individual basis. I think healthcare advocates have to be part of a larger community of healthcare advocacy, where it's more of a community-based approach of taking care of an individual, so they don't feel like they're the only ones who need help. I think if you create a strong healthcare advocacy network, that'll allow for people to feel like they're not the only ones who need it. They're not alone. If it's part of society, if it's more normalized, then people will feel more inclined to take care of themselves. And then I think in the long run, it'll really um, mitigate all these issues in terms of mental illness. And in that same vein, it'll help also deal with the more traditional physical illnesses that people tend to prioritize.
Okay, so you talked about how healthcare advocacy is such a urgent thing right now. So how has healthcare advocacy evolved in the past decade or so? And what makes it so urgent right now?
I think that's a really good question. So I keep bringing up the Affordable Care Act, but I think the idea of healthcare advocacy, and the reason why I feel like the reason why I'm bringing up the Affordable Care Act is because it has such a huge impact on what I'm doing right now. So I think that's where I'm the most knowledgeable about the current that part of the industry and healthcare in general. But I think the change has been incremental, but more it started to speed up in recent years. I think in the early to mid aughts, there was a bit of a mental health crisis and a opioid crisis that started to surface, and it only got worse. And I think people realized that the traditional way of healthcare was just not working out for these people who are really suffering, and especially for the marginalized communities who don't get the care they need. There are not enough doctors. There are not enough healthcare professionals in their communities. They tend to suffer the most. So like the Black and brown communities who are, as it is, shunned aside. I think they really were really at the bottom of the ladder there. But um, I think at the opioid crisis really shined a really bright light on the fact that the traditional way of medicine is just not working in terms of solving the crisis. So I think people start to look at different out of the box ways of treating people, and they saw that a community based approach, um, a healthcare advocacy based approach, where there are more preventative measures in place to prevent uh, individuals from spiraling out of control, whether it's through mental health crises or opioid or drug addiction issues. I think that's where it really started to change. So I would say I would point to the opioid crisis as the kind of a demarcation of when things start to really change in terms of healthcare advocacy and the importance of healthcare advocates and that kind of idea within healthcare. But yeah, I think now more so than ever, we're seeing that it's actually starting to make a difference in people's lives. And I'm not saying that the opioid crisis is over, but I think we're on the right trajectory there. And I think we should only keep the ball rolling in terms of healthcare advocacy.